So I hope you had a good lunch break. So without further ado, let's move on to our third module on psychiatric medication by Dr. Choong Wen Mei. Over to you, Dr. Choong. Dr. Choong, unmute yourself, I think. You haven't unmute yourself.
So, hello everyone. Today I'll be presenting on the third module, which is about the psychiatric medication. So before I go on to more details about the medication, first of all, we could let's see about what are the common myths that people think about our medication. So the first is a lot of people, they think that mental illnesses are psychological problems. Therefore, they think that medication would not help. The second one, they think that psychiatric medication only sedate the patient. So this medication only cause patient to sleep for most of the time, and it would not promote the functioning of the patients. The third would be psychiatric medications has many serious side effects and they are dangerous. The fourth is the psychiatric medications actually make the patient worse. And long-term use of psychiatric medication would actually lead to drug dependence. I think many of the common people, they have such thoughts. So by the end of this presentation, I hope that we can have the answer for these statements, whether we would see whether these are true or not. So this presentation would be generally about the brain function and how does the psychiatric medication works, and the three major classes of psychiatric medication and also their side effects, and what should you do if side effects do occur. And of course, this lesson does not actually aim to teach you how to prescribe psychiatric medication. So leave these to your doctors. So first of all, I will just briefly go through about the function of the brain. So as all of us know that the brain is actually the most important and also the most complex organ. So the brain actually controls all the process that happens in our body. The three major functions are processing information, coordination and also balancing, and the brain also actually the function is commanding actions. So for example, when we have a stimuli from the surrounding, and then when our five sensory organ receive this stimulation, which includes our hearing, vision, taste, smell, and touch. So the sensory organ will actually send these signals and information to the brain, and our brain will process this information and will let us know what are the sensory or the stimuli that we receive. So generally in the brain, it is actually consists of millions and millions of nerve cells, and each nerve cells are actually interconnected with each other, and they form a web-like information exchange network. So a nerve cell, or we call it as a neuron, it consists of body and also multiple tracts, which are dendrites and axons, but I will not go into too detail about that. But generally, if you want to transfer information from one neuron to another neuron, it is actually mediated by what we call as the neurotransmitters. So what are actually neurotransmitters? Neurotransmitters, they are actually a chemical they're actually chemical compounds in the brain, and there are various types of neurotransmitters in the brain. So what is this? Why is that very important about these neurotransmitters, especially in when we talk about mental illness, when we talk about psychiatric disorder? This is because the main cause of the mental illness is due to the imbalance of the neurotransmitters secretion. It can either be too much or too little. So while we talk about these neurotransmitters, aside from it is the main cause of causing mental illness, it is also the target of our psychiatric medications. So our medications, because when they're imbalanced in this neurotransmitter causing the disorder, so our medication will target on the imbalance of this neurotransmitter. So our medications actually has been a history since it was discovered first in 1950s until the present. So that is why we have older generation of psychiatric medication, especially the antipsychotics. We have older generation and also newer generation of psychiatric medication. So basically we call it as a newer generation if the medication is discovered after the 1990s. So I have mentioned just in the previous slide that the medication used in psychiatry is they actually regulate the neurotransmitter in the brain. So if there is excess of neurotransmitter in the brain, so our medication will bring down the level to a normal level. So if there are too little, so we will increase the neurotransmitter level in the brain. So these are the examples of neurotransmitters that causes the mental illness. So in schizophrenia, it is because there is an excessive of dopamine. So dopamine is the neurotransmitter. So because there is an excess of this dopamine, it causes a patient to have schizophrenia. But whereas in depression, there's actually insufficiency of serotonin and norepinephrine. For bipolar disorder, it is actually there is an imbalance of various types of neurotransmitters. So because there is excess of dopamine in schizophrenia, so our antipsychotics, which is the medication we use, it is to reduce the level of dopamine. So in depression, the medication we prescribe are to increase the level of serotonin and norepinephrine. Okay. So I will go on to the next slide. So when are medications needed? A lot of patients will be, I think they'll be thinking about this question. When are medications needed? So basically, if your doctor have decided to prescribe medication for you, it means that the doctor has already weighed the benefits and the risks and thinks that the benefits that you would receive are generally it's more helpful for your condition. So normally in these situations where medication will be prescribed, which is when the symptoms of the mental illness, when there are symptoms of mental illness or when are the signs of relapse and the presence of the signs of relapse. So second one will be the abnormalities persist. The third one will be the symptoms has already affect your daily life and when non-medication treatments are ineffective. So doctors would not simply prescribe medication, and a lot of times patients are very worried that, by taking medication, they will have some side effects, and they are worried. Generally, patients and carers, they usually focus more on the side effects, but they do not look into the benefits that a person would actually receive when you're on medication. So a lot of times when non-medication methods has already not working, the symptoms is very disturbing, affecting your daily life, you could not work, could not go to school, and affect your relationship with your families and friends, and it is at the times when doctor will decide to prescribe medication for you, taking into consideration the risks and also the benefits. So these are the examples of the oral antipsychotics that we have in the market. So antipsychotics are medication used to treat psychotic disorder, including schizophrenia. So we can see that there are actually a lot of medications available in the market, including the conventional and also the newer generation of medication, which we call it as the atypical medication. So some people, they may ask what are the difference between conventional and atypical. So aside that atypical, they are newer medication. Generally, they have lesser side effect compared to the conventional medication. But at the same time, of course, it is pricier. more expensive compared to the conventional medication. But however, both types of medication, they are equally effective. All of these medications are equally effective. So besides oral medication, we also have depot. Depot means injection. So for psychotic disorder, including schizophrenia, in patients, who tend to forget to take their medication or reluctant to take medication every day, they feel that it is inconvenient, sometimes up to 2 times a day, 3 times a day. So they can opt for injection actually. So it is the same as oral medication. So injection medication also can be divided into conventional. It means that the older medication and also the newer antipsychotics. So usually they are being given every 2 to 4 weeks. And currently we even have latest injection for antipsychotics. They even can be used once in every 3 months only. So now it is going towards that era whereby it is more convenient for patients, and also you would not need to require to come to the hospital so often or remind you of your illness if you are taking medication every day. So injection are generally more convenient and also improve your adherence to the medication. A lot of people, a lot of patients, they always say that I do not want medicine. So why? First of all, it could be because they have poor insight about their illness. Because, patients, they are ill, they're having illness, so their judgment might be impaired. They might have poor insight of their current situation. So it is important as a carer to encourage them to take medication, not just give in to them, because they say they don't want medication, and as a carer, we agree with them. We shouldn't be, because they might not be able to make a correct judgment at a point of time. So we might need to encourage them to take medication. And a lot of people, they have this thought that, I'm recovered, I do not need further treatment, or they do not want to be labeled as mental patient due to afraid of stigmatization. Some people, they say they want to try their own effort, they go for more to some cultural practice or cultural beliefs. And some people, because they don't trust the doctor, not sure, maybe they have some previous experience. Or they might, because they have experienced some side effects from the medication and they do not want the medication. Some, they might be because of financial and transport problem. But the most important thing I feel is to communicate the reason that you do not want medication with your doctor, so that we can look into it together and see what is the best options available or better, more suitable medication for you. So, but if you don't tell your doctor and don't inform to your doctor that you have some certain concerns or certain side effects, then the doctor wouldn't know, right? So speaking about side effects, so I know a lot of people, they are very concerned, especially the side effects. So these are the usual side effects if a person is taking antipsychotics. So they might experience some extra pyramidal symptoms. So in layman term, it means that they might have some stiffness, might have some tremors, or some even might have some inner restlessness with antipsychotics. And other than that, they might have experienced some dry mouth, blurred vision, constipation, urinary retention, or increased heart rate. These are the common side effects. And other than that, commonly is sedation, tiredness, increased appetite, weight gain, sexual dysfunction, irregular menstruation, abnormal breast secretion, diabetes, hyperlipidemia, overdose, of course, can be fatal. But just as a note to everyone that actually different antipsychotic, they have different side effect profile. So certain medications, for example, it might cause you to have increased appetite, but certain medication, it would not have this side effect, which is more not so pronounced. So For example, if you are concerned with this side effect, you could discuss with your doctor and we could change you to another medication which has lesser side effect on the profile. It's not that they would have all these side effects together in one medication. Okay, so for example, a person is worried that it might cause a very sleepy sedation, then you could discuss with a doctor and we could see whether we could change to another medication for you, or the medication dosing, maybe we can put it at night, take before sleep, so that daytime you could go to work. So, and if patients is taking clozapine, it is particularly that we need to take note is that it could cause an abnormal decrease in the white blood cell. So that is why if a patient is taking clozapine, we would need to have a weekly blood taking for the first 18 weeks to review the white blood cell level to make sure that the level is in a normal range, because white blood cell in the body, it is used to fight diseases. It is mainly used to use in our immune system. So if, let's say, clozapine has caused you to have a decrease in white blood cell, it means that you are more prone to infection, and if you have infection, you could not fight the disease. So that is why it is very important to monitor the level if you are taking clozapine. And after first 18 weeks of monitoring, which is weekly, it will be followed by monthly of blood taking review. And of course, not everyone who takes antipsychotic would experience side effects. It depends on each person and their preference and their body reaction. Not everybody will definitely develop side effects. A lot of patients we see in the clinic, they are on long-term medication, they actually do not have any side effects. So the side effects, like I've mentioned in the previous slide, could be minimized by adjusting the dose or choice of medication. Or if, let's say, for example, when taking this medication, you notice that you have some stiffness of the body or some tremors, it could be reduced by adding a medication which we call it as Artane. And please consult a doctor or discuss with your doctor if you have any side effects experience, so that the doctor could make adjustment for you. Do not just stop your follow-up abruptly, and just didn't go to the clinic for your follow-up just because, you don't like the medication, you don't think it's suitable for you, or you have side effects. Always come to discuss with a doctor because there are many options available. Okay, so for the first part, I've been explaining about antipsychotic medication, which is used to treat psychotic disorder, for example, schizophrenia. So now I'll be talking about antidepressants. So basically, antidepressants, although it is called as antidepressants, it can be used to treat depression and also anxiety disorder. So both disorder can be used. We'll be using the same type of medication. So again, there is a wide range of medications available in the market with different groups of medication. For example, we have the tricyclic and tetracyclic groups of antidepressants. So these are the examples: amitriptyline, imipramine, clomipramine, dotiapine, and so on. We have other groups as well, which are the newer antidepressants, including our SSRI, SNRI, our NASA, our RMA, and other types of medications. And the common side effect for antidepressants, usually patients, common is they would complain of some nausea or vomiting, a bit of gastric pain. So usually we will advise patients to take the medication after you have taken your meal to reduce this side effect. So other types of common side effects including some sedation, tiredness for antidepressants. So something to note about psychiatric medications doesn't only include antidepressants, but also other types of medications such as our antipsychotics and our mood stabilizer. So our medication do not work immediately. They are not like your your paracetamol, or they're not like your flu medication, it doesn't mean that you only take when necessary. When you're feeling depressed, okay, then I take one medication. When I'm feeling better, I do not take your medication. It does not work in this way. And also, you do not expect that, by taking one table of medication, it would work miraculously for you and immediately for you. No, it is not like that. So you need to take your medication regularly and give some time to this medication to work. So, and usually it takes around 2 to 6 weeks. Only gradually you will see the effect of the medication. So be more patient about that. And because many patients we see in the clinic, they take 1-2 doses of medication and they come back to the doctor and they tell us that, it is not effective, it doesn't work. It doesn't work in this way. Okay, so combination of different antidepressants may cause serious adverse reaction. So usually if you come to us, you will notice that we would start slow and go slow for your medication. And also, if possible, we would not combine the medication for you, because if it is in combination, so there will be more side effect experience. For the side effects of newer antidepressants, usually they are transient. It means that probably when you first take the medication for the first few days, you might experience some nausea, some dizziness, but continue to take your medication. Do not stop the medication after you take for just 1 to 2 doses, because usually the side effects goes away when you continue to take the medication for a few more days. So if you do not respond to the medication, the doctor will change to another medication for you. So move on to the third group of medication that are commonly used in psychiatry is the mood stabilizer. So the common mood stabilizer that we use is lithium carbonate. So mood stabilizers are used for bipolar disorder. So for lithium carbonate, the common side effects include some patients, they might complain of a metallic taste, the metallic taste of the medication. So sometimes they do not really like the taste. And the other common side effects are patients, they would notice that they have frequent urination and also frequently complain of feeling thirsty. Because this medication, lithium, it is basically being excreted from our body by the kidney. So it means that it is basically being processed by the kidney. So it is important to drink a lot of water and make sure that you stay hydrated when you are taking the medication. And before the doctor, start you on lithium, we would also take some basic baseline blood investigation to make sure that your kidney is functioning well. And aside from that, doctor will also do a regular blood monitoring for you. Generally, is every 3 to 6 months to monitor the level of the function of your kidney, the function of your thyroid, and also monitor the lithium level in the body. So why is that so important to monitor the lithium level in the body? Because we would want it to be in the desired range, which is from roughly 0.6 to 1.2, which is around, more or less at around 1. Because if the lithium is in a too high level, if the level is too high in the body, it could cause toxicity. And in a worst case scenario, it could even be life-threatening. So that is why the doctor would need to check regularly on the lithium level in your body. And for long-term wise on this medication on lithium, so it could also affect your thyroid function. Usually it will cause a low thyroid hormone. So that is why we would also monitor your thyroid hormone and also will monitor your kidney function at the same time. If, let's say, we notice there's any abnormalities, so the doctor would either, refer you to refer you to medical department to see what further we can do, including, you know, whether to correct your thyroid function or stop your medication if your kidney is too affected. So it will depends on the situation. Other mood stabilizers that are being used to treat bipolar, including anti-epileptic drugs such as carbamazepine, sodium valproate, which is commonly known as Epilim, and also lamotrigine. So don't be surprised, you know, when you see that how come the doctor prescribe you with anti-epileptics, because I've come across some patients when we have prescribed them with mood stabilizer, and when they go to the pharmacy told them that they are actually taking epilepsy medication. They get very surprised and they stop the medication. So actually, these medication, they do not only work as an anti-epileptic drug, but they have a very good mood stabilizing effect as well. And it is the main medication that is used in psychiatry to treat bipolar disorder. So the common side effects that it causes, including some sedation, tiredness, nausea, weight gain, rashes, and if you stop this medication suddenly, it could even induce a seizure. That is why never just stop your medication before discussing with your doctor, because this medication is used to treat epilepsy. So if you stop the medication suddenly, could cause a seizure. So I've mentioned to you about three major class of medications, which are the antipsychotics, the antidepressants, and also the mood stabilizers. And besides these medications, we have some supplementary medications which are commonly used in psychiatry as well. For example, we have Atane, which I've mentioned in the past that it is used to treat the side effect from antipsychotics. And we also have some anxiolytics, which are the benzodiazepines and the non-benzodiazepines. So generally, this diazepam, midazolam, lorazepam, alprazolam, clonazepam, they are actually what is commonly known as the sleeping pills. These medication, they only have sedative effects. They do not have any antidepressant effects. But a lot of patients, they like to request this medication because it improves their sleep. But when you come to the doctor, usually the doctor will be trying to prescribe you with as a low dose as possible, or to avoid this medication as much as possible, because this medication, the benzodiazepines, the sleeping pills, could cause dependency. So unlike other medications that I've mentioned just now, those medications do not cause dependency. You can stop the medication as instructed by your doctor. If you know, if you have already recovered, if you do not need them anymore, you could stop those medication under the advice of your doctor. But for sleeping pills, it is very difficult to stop these medications once you are addicted to them. So it means that over time, if you take this medication, you will need to take more and more. The dose to be higher and higher. And once, if you don't take this medication, you could not sleep at all. So this is what we call as dependency. So overall, it is very important to let the patient to understand about his or her mental condition and what is the reason that he or she should be taking medication. So as a caretaker, as a family members, we could monitor their medication taking, and we could also encourage them to share his or her feelings or his or her doubts about the medications, feel about their perception about their illness. And we can remind them in a positive and persuasive way, you know, to encourage them to take medication. Try to be less forcing or less harsh, but, you know, more persuasive way if possible, you know, so that could encourage them to take medication and turn taking medication into a habit. Because I think nowadays a lot of people, they're also taking other supplements as well. They're taking every day multiple type of supplements, but medication they refuse to take. Just take it as you were actually taking your supplement. Just make it as a usual habit. So now at the end of my slide, we will go back to see about the common beliefs of patients regarding mental illness and also regarding the medications used in psychiatry. So first one, mental illness and psychological problems, so medication would not help. So it is not true. Basically, in many conditions, in many types of mental disorder, medications actually help. Okay. So second, psychiatric medication only sedate the function. It does not promote functioning. So yes, it could be some of side effect of certain medications, but doctors would, adjust the dosage for you and also the timing of medication for you. And when for example, your underlying mental illness or mental disorders has already getting better, so this could promote your functioning to work, to go to school as a parent, taking care of children, and etc. So the third one, psychiatric medications has serious side effects and they are dangerous. So these are actually not true. They have some side effects, but they are not very common. And if you do, you could always seek advice from your doctor. Psychiatric medication make the patient worse. This is not true. It actually promotes recovery and improves functioning for the patient. So long-term use of psychiatric medication would lead to drug dependency. This is only true for the sleeping pills, which I have mentioned. So this is the last slide of my presentation. So if everybody have any questions, you could leave your questions in the chat area.